Today is part of our evaluation of facility assessment to see how our facilities are capacitated and how SHA is being implemented in the various facilities. This week will be in Nairobi County, but we'll move even to the further regions and hope to complete or cover the 47 counties. Today's assessment, we have been able to pick some good stories, but again, there are challenges which we will have robust interventions to address them immediately as the Ministry of Health. First of all, we visited the renal unit, where we have seen patients who are undergoing dialysis. We have even seen a patient who has undergone transplant. And so indeed, this tells us that implementation is going on at screening level with the community health promoters, picking out conditions like diabetes, hypertension. And at this level of care, we see that patients who have been diagnosed and are on dialysis, undergoing dialysis. While undergoing dialysis, we have noted that they are actually receiving erythropoietin and other medications that are used for renal patients. So we are happy that our dialysis patients here in Kenyatta National Hospital are receiving optimum care. We have also visited a patient who has undergone a transplant under the Social Health Authority. And this, we are very happy. This is our first successful patient in Kenyatta National Hospital. He's day 5 after the operation, and he's doing very well, and we'll cover the story. Equally, we've been able to see some challenges which we will be addressing. First of all is the equipments. We take note that the dialysis equipments here in Kenyatta are not able to cater for all the patients. And so we are issuing a policy to ensure that the EAKI, that is East African Kidney Institute, will be able to give 10 dialysis machines to Kenyatta Hospital so that patients can undergo seamless dialysis here in Kenyatta Hospital. Equally, we encourage patients to undergo transplant. As you can see, we've had various successful transplant procedures in Kenyatta, and now we have one under SHA and another one is actually going through preparation. So just by registering, one is able to access the services, dialysis and transplant services. So after that, we have moved to the cancer unit, where we have seen various patients, some undergoing chemotherapy, others undergoing radiotherapy. We are happy to take note that as minimum as 300 shillings contribution, we are having patients now having services in cancer therapy services here in Kenyatta. We want to tell Kenyans that you can have screening services, you can have prevention services and management, as well as rehabilitation for cancer. We've seen the radiotherapy, and we have seen patients who have undergone radiotherapy under the Social Health Authority, and we have seen patients who have undergone chemotherapy under Social Health Authority with a minimum contribution of only 300 shillings. And so, as our gentleman in the dialysis said, patients should test for themselves. For me, the key highlight as the Ministry of Health is that we need to ensure that equipments are equitably distributed all over the counties as well as in level 6 hospitals. And under the NESP program, we are having taking agreements together with our county governors to ensure that they sign and they are able to have these equipments. These will be equitable all over the country, and patients can have affordable, accessible, quality care through these interventions. Another take home for me is that we need to strengthen our support groups. What we have seen is misinformation from various channels, and this can actually lead to loss of lives. And so I want to encourage the communicators, the media team, let us communicate well. Where our dialysis patients, as you have seen them, they are undergoing seamless dialysis, they are up, and they should be told that they can access those services. Equally for cancer cases. With misinformation, In other ministries, it may just be a road or something else, but in health, it actually affects the health of a human being, a mother, a father, or a child. And so it's important that we give the right information to the people of Kenya so that they can be able to access these services. So my kind and my humble request to the media team, you have seen patients are undergoing dialysis with a minimum contribution of 300, or the poor people who cannot access, who we call the indigents, they can have their services at no cost. But from a minimum of 300 shillings, they are accessing services. If we send the wrong information, patients will stay at home and they will die. So let us capture the good testimonials so that patients are able to understand that services are ongoing and they need to access them so that they are able to live a quality life.